Hello, my name is Dr. Lesia Waschuk, and I'm the Compliance and Education Specialist at Prep Doctors. And today I'm going to be speaking with Dr. Marwan and Dr. Ibrahim Saadeldin. And they're both instructors at Prep Doctors. They also work in private practice. And I'd like to speak with them about their experiences as associates and as a principal associate pair.
Thank you, Lesia. Thank you for having us.
Marwan, now you're a principal. Before that, you were an associate. Can you tell us a little bit about your experiences?
So I'll talk a little bit about how I started and then how I transitioned from a principal to an owner. So when we first graduate from university, we look for an associate position. We graduate with an idealistic view of dentistry because I graduated from University of Toronto. So I had this ideal way of doing every procedure, how they taught us in school. And once you start to associate, you start to see, oh, it's not the same. Mm-hmm. Okay. The materials are different. The procedures may be different. There is shortcuts to things and stuff like that. So you start to see that the environment is not the same as a school environment. And you want to do things the ideal way. Now, of course, the speed also is an issue because in school, you have a lot of time to do the procedure. Now you're limited by the clinic. And the other thing that you feel as an associate is there's always someone watching you and watching your performance now. So I started working as an associate. To be honest with you, I had to change a clinic many times in the beginning of my careers because if I wasn't happy with the performance of the clinic, if I felt it wasn't the best environment for me, I had the luxury to switch the clinic. Now, the other thing that when I graduated, I didn't have a lot of responsibility, so I had that luxury to switch clinics. Now, for someone who has big financial responsibilities, this becomes a tougher decision to do. Until I settled in clinics that I thought they were the best choices for me. The dilemma I had and the conflict I had at that time is I always wanted to use the best material for the treatment, but I felt a lot of resistance from the owners. And the owners always used to talk about production, used to talk about overhead, make sure that things balance out. They used to get upset if you repeat a procedure twice. And as an associate who just started, this wasn't clear. Why is this the case? Now, after I transitioned to become an owner, then I started to see the bigger picture now. I start to see how this factors into the profitability of the business. It factors into the financial sheets at the end of the day. Now I started to understand that taking impression 2 times is going to be costly for the clinic. Staff is important and so forth. So my experience as an associate, my primary focus was on the care for the patient. And the best experience I had is when I worked in a community health center, because that was free of the business side. When I got to the business aspect, I tried to balance between both because I want to provide the best care for the patient, but at the end of the day, you still have to have a successful business model. And I found it to be much more challenging to be an owner than to be an associate.
Wow. You've given us so many topics that we could discuss in detail. So what I thought maybe we could do is if I could hear from Ibrahim about his experiences before he came to your office as an associate or while he's been an associate at your office, and maybe we can pick out some themes, right? Some common themes that you've both addressed and then talk about those again, okay?
Hi, thank you, Lesia. So my experience is a little bit different than Dr. Marwan's experience. So when I first started practicing dentistry in 2016, I was also a fresh graduate. I haven't done any practices before, so I was a fresh graduate, and fortunately, not a lot of time took me until I found a clinic that I was comfortable in, which is with Dr. Marwan. Before that, I had a couple of experiences with the clinics, and the same thing happened. I wasn't able to continue in these offices for multiple reasons. One of them is that you're not comfortable with the environment, you're not comfortable that the way that the clinic is run. And this is something that I believe anyone who is looking for an associateship needs to be looking for. At the end of the day, you do need to be comfortable in the place that you're working. You need to be in a position that you go to work because you want to go to work, not because you're forced to go to work. And this is what drives people to change a clinic from one to other, until you find an owner of a clinic that provides for you the needs that you require to perform in a clinic and to actually do the things that you like in a clinic. So this is my experience. It wasn't very long. I worked in a couple of clinics before I joined Dr. Marwan. And the experiences were not 100% negative. So there are definitely a lot of positive things that came out of these experiences. I learned a little bit about how the different clinics work and how different areas in the dentistry are operated as well.
So what I think that we might be able to talk about next is something that Marwan said. So the difference between what you learn at school and what you see in different practices, right? Ibrahim has said different practices, things are done in different ways. Mm-hmm. I think, what do you think about how easy it is for an associate to learn the culture of the practice as it is, or to figure out whether this is a good fit for them?
So to be honest with you, you will know if it's a good fit. Something it's called gut feeling, right? So when you start working in a clinic, right, the first week you'll know if things are gonna work out or not. First of all, by interacting with the staff. Mm-hmm. Some offices, they have a high level of politics taking place in the office, and you sense it. Mm-hmm. And that's not the best office to stay in. Some offices are calm and so forth. Also the flow of the patient. So that are coming, the type of the patients, the complaints of the patients, the turnover of the dentist before you, like, is this an office that had a stable dentist before, or they're always changing dentists? So I've seen it all during my associateship. Some offices, they change dentist every month. You know, if they're changing dentist every month, there is a reason why that's happening. So, but to be honest with you, they all add to your experience. Like, you're going to learn from the office one of two things. You either will learn what to do or what not to do. Okay, so the office will give you one of those two experiences. And my initial experiences with associating taught me what not to do. Mainly taught me what not to do, until I found a clinic where I settled in. I started associating in Guelph and in Mississauga. So the question that you were asking about, how do you know if this is a practice that is good or not? You have to try it out. You can get a feeling from the interview, but sometimes it's misleading. I remember the first office I worked at, the interview went amazing. The dentist, I felt he's very welcoming. He wanted me to grow with them and so forth. And the minute I started working there, a lot of tough dentistry being done and a lot of things that I didn't like. And they even were against the standard of University of Toronto. So I didn't feel comfortable to continue.
So when you say tough dentistry, what did you mean?
Lack of supply is one. And the timing provided for the patient is unrealistic. So they squeeze the time, and especially when it comes to new patients' exams where you have to communicate with the patient, they flip patients quickly. So you find that you're actually drained during that day. It's okay, you want to work hard, but at the end of the day, you want to feel that you accomplished something. But I felt that it actually gave me a flashback when I used to work in factories before. So that's where it becomes draining. Like, at the end of the day, and also long dentistry days, like you finish 8 p.m., 9 p.m. And some days, by the way, we went to 10:30 p.m. So that was tough. Yeah.
I mean, dentistry is physically draining for sure. I think you need a supportive environment to be able to do your best work. And you may not have your preference of materials, but you certainly need to have the basics that will enable you to provide good care.
And you need also to have a smart manager who knows how to distribute the load. Like, they can't put very heavy procedures back to back on one day. They can distribute them. They can have exams, fillings, endos, surgery. That's a nice mix. But if they pack your day with a day of pedo or a day of surgery, then by the end of the day, you'll be very drained.
For now, we're starting with entering the dental practice, which is more about trying to find the best fit that you can, right? It may not be an ideal fit, but out of the options that you have, which would be the better fit for you. And perhaps asking to speak with former associates might be a a way to.
It's true. Also, the
Yeah.
level of experience plays a role, Lesia. What's important, I tell people when they go for interviews, is look at the schedules. Look at the schedule of the clinic. You will know, because the new graduates, they have different speeds, different experience than people who have been working for 10 years. So make sure you match the expectation of the owner. If the owner is looking for that you have to see 20 patients a day and you're a new grad, you know this is not the best fit for you. You're going to be upset. You're going to be disappointed. He's going to be disappointed. So don't start there.
Right.
Start in a slower clinic until you build your experience. Yeah.
Now, Ibrahim, I liked when you said, they weren't all negative experiences, right? And some of this has to do with our outlook. We look at the situation. What can we take away from it in a positive way, which may be, as Marwan had said, knowing what not to do. But when you were talking about not all negative experiences, what were some of the positive experiences you took away from your associateships?
So definitely there are a lot of positive experiences that you gain, even if you work in a clinic that is not the right fit for you, for reasons that doesn't have to mean that this clinic is a bad clinic or this physician or this owner is a bad owner. It just doesn't fit for you. As I said, I was just graduating. Speed is going to be a factor, as Dr. Marwan was mentioning. Also, lack of patience is also a problem. So I've worked in a clinic that which is not always a bad thing to have, but there's 3 patients to 4 patients a day, and you just have to stay there for 8 hours, and you see these patients, and they are spread around throughout the day. But the experiences that you get to start actually practicing dentistry, because when you are still undergrad and you're still in university, you're still practicing dentistry, but you're doing it in phases. So if you're doing a crown, you're going to bring a patient once, and you're going to do the treatment plan, and then you're going to bring him again to start the preparation, and then you're going to bring him again, and so on and so on. But now in a clinic, you will understand that, okay, you have to be time efficient. You have to treatment plan in your head. What are you going to do? The steps that you're going to follow. So all of these are beneficial things that whenever an associate is starting in an office, these are the initial things that he needs to get a grasp on, his pace, that and one of the most important things that I've learned when we started, actually I started working as an associateship, is patient communication with the patient, communication with the staff, communication with the front desk and with the assistant that you're working with. So communication in general is an integral part in dentistry, that I believe this was added to my experience when I worked in different associateship clinics and so on.
In terms of gaining the speed that you need to be successful in an associateship.
It makes all the difference. Yeah, it makes all the difference when you have an associate or you have an assistant that is actually doing, when you're actually doing 4-handed dentistry, is different when you're doing 200 dentistry with only someone who's just holding the suction. An assistant who actually is working with you and is providing the treatment with you to the patient definitely makes all the difference for the treatment of the patients, for the flow of the patients, for the speed of the treatments and so on.
So the communication with that team member, and I guess perhaps in a situation where the relationship isn't a supportive one, then you might feel like that person is watching you and perhaps.
Definitely. And this is when you can decide either to fix the relationship or to find a way that to communicate better with the staff of the clinic, or the other way happens that you can't communicate with the staff, and this is when the relationship between the dentist and the clinic fails because of the inability or incompatibility between the dentist and the staff of the clinic, or the way that the clinic is run. And this is when you should consider, okay, I need to then, if I'm not properly working with the team that I'm with, then I should be considering another approach or a different clinic or something.
I think that's very true. And the communication that you'll have with different team members will be in relation to different aspects of the experience that you've mentioned already. So the bookings, right? You'll be communicating with front desk staff about your expectations or your hopes, and hopefully those are aligned with what the principal has been directing them to do in terms of your schedule.
Communication and confidence.
Confidence.
Communication and confidence is important for an associate, because one of the challenges associates will feel is that if the staff start to sense that this associate is not experienced enough, he will get pushed around. And if he starts to get pushed around in the clinic, he will be frustrated, and that will lead to a negative outcome. So it is important that you maintain the respect for the staff, you communicate with them, but at the end of the day, you have to earn their respect in the clinic.
I guess I have a slightly different point of view on that. I think that sometimes it's that the staff doesn't respect an associate, that it comes across as insecure. But sometimes it's that the principal themselves don't express confidence in the associate that they've hired.
I agree. Yes. I agree. Yeah. It comes from both sides, because the principal is also watching over the associate, and he gives them the luxury to relay the information to him about what's going on. But this is where the challenge is. If the staff have been dealing with the principal and he was doing dentistry a certain way, what they don't understand is sometimes there's two opinions or two approaches to dealing with a problem. So if they see there's a different approach, because an assistant doesn't have the same knowledge as a dentist, she will assume this is a wrong approach. And that's where it starts.
So I hope that you will speak with me again about some of these challenges that come up in the principal-associate relationship and in the relationship between the associate and the staff. And maybe we can talk about some approaches that you have found to be effective in resolving them, or when you knew that it was absolutely a no-go when you had to leave a situation.
Definitely, it would be a pleasure.
Okay, thank you so much.